Coming of Age is coming up next. I'm your host, Emily Echeverria. Today, we'll be talking about preventative health for older adults and how to best protect your health and screen appropriately for better outcomes. Next up, we'll be checking in with Pensacola Symphony Orchestra about the upcoming season of concerts and programming. Finally, we're discussing heart health, how to keep that ticker in top shape, and what to look out for with the heart as you age. Stay with us. Coming of Age starts right now. As we age, staying active in life and involved in the community can become a challenge. But with Council on Aging of West Florida's wide range of home-based services, you remain healthy, independent, and engaged. From Meals on Wheels and respite care to senior dining sites and the retreat, you'll find the support and connection that you need to age well. Aging looks different for everyone, and we're here to help you meet your needs and thrive while maintaining what makes you, you. We've been in the community since 1972, advocating for elders and supporting those who care for our parents and grandparents. Now, join us as we discuss the age-related issues that matter to you. Quality healthcare for individuals includes two fundamental elements: appropriate treatment for current illness and appropriate preventative care to attempt to lessen future health decline. Preventative healthcare is an important aspect of medical practice. Several issues are involved in providing effective preventative care. The goal of our discussion today is how individual patients should approach preventative care and how to prioritize preventative services. Here to talk to us today about this is Dr. Keiran Shute, a family medicine physician that provides care to patients at the Baptist Medical Group Primary Office in Gulf Breeze. And thank you for joining us today, Dr. Shute.
Thank you for having me.
So how does someone prioritize healthcare preventative services?
That's a great question. Certainly we should focus on priority health problems and effective interventions. Rather than performing the full physical every year, we certainly want to individualize screening for each patient, prevention interventions to maximize the value, but also to minimize the trade-offs between benefits and harms of screening. A lot of clinicians refer to the USPSTF, or the United States Preventative Services Task Force, for the most up-to-date screening recommendations. Priority services differ between different patients and different populations, and the effects of recommended preventative screening can really make a difference in longevity and quality of life, and it can vary widely between patients.
Okay.
There are potential harms that can come from screening, including anxiety produced from false positive screening tests, harms associated with diagnostic testing after a positive screening test, and the overdiagnosis of conditions that may be treated that would never have even become clinically apparent. Sometimes weighing cost and benefits to the test matters as well.
Gotcha. How do you assess health and the trajectory of health?
It's a good question. Certainly when assessing vitality, we want to look at the target that we're trying to optimize. Essentially, I look at this from two lenses. One is lifespan and the other is health span. Lifespan is really binary. You're alive or you're not. It's how long you live. They're really the four main components that affect the lifespan, are what I consider the four horsemen of disease, or horsewomen. Atherosclerotic disease, neurodegenerative disease, cancer, and metabolic disease. Certainly those don't immediately cause death, but are the underlying contributors to health decline. And then health span. So conceptually, this is the cognitive, physical, and emotional piece of longevity. Cognition matters as we age. We certainly have a way to evaluate cognition clinically. Physically, there's functional metrics of fitness and functional metrics of mobility. There's also hormone testing for men and women. The other component is emotional. So this is an under-evaluated piece, but the quality of your relationships, your emotional state, the things that affect you in the long term, essentially.
Mm-hmm. And what is the assessment for atherosclerotic and cardiovascular disease? And did I say that word right?
Yep, that's accurate. So one of those components, the atherosclerotic disease and its sequela, is essentially, we look for underlying risk factors. So diet is very important. Exercise. We think that a third of all cardiovascular disease can be prevented by adequate diet and exercise. We evaluate for obesity, so via body mass index. Diabetes, we screen the general population for diabetes. Certainly everyone overweight or has a family history. Obesity and dyslipidemia are the components that we start to screen for atherosclerotic disease. From a vascular perspective, it's recommended for men at age 65 to undergo an abdominal aortic aneurysm who have ever smoked before. Additionally, if there's any underlying family history or history of a AAA repair, we tend to screen with an abdominal ultrasound.
And how does someone reduce the risk of cancer?
So similar to atherosclerotic disease, we like to reduce the potential harmful behaviors. So that's tobacco is a huge component. I think I missed that in the atherosclerotic piece. So smoking is a component there as well. Minimize alcohol intake, have a healthy diet and exercise. And that's just about it.
Mm-hmm. What are the cancers that are screened for in primary care?
So primary care cancer screening is a huge component to the preventative health evaluation. For women, typically breast and cervical cancer are screened for. Breast cancer, that conversation starts with primary care clinician at age 40. There's mixed evidence about starting with annual screening mammography at age 40 versus 50. For cervical cancer screening, we typically start screening at age 21 all the way up to age 65, and that's done via Pap smear for cytology and HPV after age 30. In the entire population, we screen with population with no risk factors for colon cancer, starting at age 45. Lung cancer screening for a discrete portion of the population, which is if you have 30 pack years over the age of 50. The other cancers that we commonly screen for, which is relevant for the population in Florida, is skin cancer. We do recommend doing an annual screening evaluation. Certainly if you're high risk, the population is the white population, the over 50 nevi, very sun-sensitive individuals, and a personal history of skin cancer.
And what are some of the other preventative measures to optimize health and just reduce the general risk of disease?
So we like to screen also for osteoporosis. That usually starts at age 65 in postmenopausal women, and also before age 65 with any risk factors for osteoporosis, and also in men with any clinical manifestations of kind of low bone mass, history of low trauma fracture, or history of fracture.
Gotcha. Thank you for sharing this information with us today, Dr. Shute. We're glad to have you here.
Thank you. Appreciate you.
Stay with us. We've got an informative interlude with the Pensacola Symphony Orchestra next.
If you love them enough to relearn math so you can teach them math, then surely you'll check nhtsa.gov/the-right-seat to make sure they're correctly buckled in the back seat.
If you're looking for a fun and exciting environment for your loved one, then L&L Executive Adult Daycare is a perfect fit. We offer social gatherings, physical activities, games, outings, and daily luncheons from Keiran's Catering. We take a holistic approach to social stimulation and aim to enrich the lives of our guests. Let us help restore your loved one's mind, body, and soul. We'd love to speak to you. L&L Executive Adult Daycare. Big business love with small town feel.
The Reesburg Institute, Pensacola's ear, nose, throat, and voice center. We welcome you to visit us at our convenient Davis Highway location in Pensacola. At the Reesburg Institute, we offer the most advanced treatment available in a calm, stress-free environment. Since 2014, we've performed over 1,000 cases in office of balloon sinus surgery, as well as septoplasty and nasal procedures using oral sedation. The in-office procedures result in a faster healing time. Visit us and feel the difference. The Beacon at Gulf Breeze offers the finest senior living community in the area. We are here for your loved ones who need assisted living and advanced memory care services. Seniors will feel right at home with studio, one-bedroom apartments, a large dining area, a beautiful landscape courtyard, and even a salon. With professional staff and one-on-one care, your loved ones are our top priority. Welcome to the Beacon at Gulf Breeze. Welcome home.
This is the story of a boy who didn't talk for a long time. The boy liked things to always be the same. Any changes would scare and upset him. The unknown was an unfriendly place. The boy was very sensitive to lights and sounds. So he built secret hiding places where they couldn't get in. The boy didn't like looking people in the eye. He wasn't trying to be mean, it just made him feel uncomfortable. Sometimes he would flap his arms again and again.
One day, I found out I have something called autism. My family got me help. Slowly, I found my voice and learned all the ways I could live with it better.
Early intervention can make a lifetime of difference. Learn the signs at autismspeaks.org.
The Pensacola Symphony Orchestra has been a foundational part of the area's arts and culture scene in some form for almost 100 years. If you only know the symphony for the varied offerings of their concert season, there's much more to the organization, like youth programs and community outreach, including at our own adult day care center at Council on Aging. We've got Julie Martin-Green from the symphony here to tell us more. Thank you for joining us today, Julie.
Thank you, Emily. Nice to be here.
First off, tell me about your role at the Pensacola Symphony Orchestra.
Well, I have a really exciting role. We believe that the orchestra belongs to the community. So my role is to build relationships throughout the community, to send our performers in, to provide music for uplifting education, and to inspire the next generation of musicians.
Love that. And tell me about how the symphony has started partnering with The Retreat, our adult day care center.
Right. We have one of our board members who is also works for the Emerald Coast Hospice. And so through that relationship, he suggested that we begin providing services at the Council of Aging at The Retreat. And so we've been doing that, and it's been a marvelous experience for both the clients there and our musicians.
And tell me about the reception and just the experience of the musicians who have been coming out and what exactly they're doing.
They are providing music that is familiar to the clients that are there, also some new music that maybe they haven't heard before. So it gives the clients a chance to re-engage with their memories, and it stimulates conversation with each other and with the staff members, and also the musicians themselves feel it's an opportunity to break down the wall between audience and performer. So it's a great way to share music and different experiences.
And I know we've had a couple different ones come out, and it's been very exciting over at Council on Aging for us. So tell me what's coming up for the next season of Pensacola Symphony Orchestra. I know that's starting a little later this year.
Well, we start with our opening performance in October, and that's going to be a really exciting performance because we are bringing back an international artist on piano, and her name is Sarah Davis Buckner, and she is apparently phenomenal, so definitely make a point to come out and see her. Also in January, we are featuring a bandoneon player, and a bandoneon is an Argentinian accordion. So he is going to be performing a concerto on that instrument by an Argentine composer. So those are really exciting to come. Something that we offer with our Masterworks performances is that we have open dress rehearsals. So those take place the Saturday of the concert, but in the afternoon, and those tickets are general admission for only $5.
Wow.
Yes.
That's awesome. Everyone should hit that up. And I hear you have some new opportunities for students through a music education program. Can you tell me a little bit about that?
Yes, I'm so excited about that. We, in the past, had a youth orchestra, and over the past couple of decades, we've not had that. So we are rebuilding our youth orchestra, and through that, we are laying the foundation this year through various types of workshops and instrument family days where students get to come and work with our musicians. Also, our musicians are going out to the schools to provide different types of educational experiences and coaching to really, again, build that relationship between the community and the orchestra.
Oh, that's awesome. And did you just have one of those recently, the music family days, or do you have one coming up?
We actually have a workshop coming up for students this month.
Okay,
yes.
Awesome. So what are some of the free events you have coming up in the late summer?
Oh, we're starting out in August at the Artel Gallery, and we'll have 2 performances, one in August and then one in November. And that's free to the public to come in. We usually have 3 to 5 musicians that play a chamber ensemble performance. Also, October is when we'll be out at Museum Plaza for PSO in the park. Again, a free time with lovely weather to come and listen to our musicians. And something that hasn't happened in a very long time, but we're really excited about, is on Veterans Day, we will be taking our Four Seasons Brass Choir to the National Naval Aviation Museum to perform in the Blue Angel Atrium.
Oh, wow.
Yes.
How can people support or get involved with the Pensacola Symphony Orchestra?
Well, first of all, our bedrock of our support comes through attending our concerts at the Singer Theater. And through that, we're able then to go out into the community and share our music. But you could also support the symphony through, if you have a company or if you have a place that you would like to make donations or sponsorships, we welcome both of those. The Pensacola Symphony is a not-for-profit organization, so all your donations are tax-free, and you can join us for that. We also have an advisory council and a board of directors, and both of those groups provide financial support to the orchestra as well as being guides for our goals out in the community. And then finally, you can just come and volunteer as well. We do have a Pensacola Symphony Orchestra Guild, and they do various types of activities throughout the year to help support the orchestra.
Awesome. If people have not been to a concert in a while and they're thinking about coming out to the concert, but maybe they feel like it's too sophisticated or maybe stuffy even, what would you say to someone about what the experience is like to come out to one of the symphony concerts if they haven't been in a while?
That's a great question. And again, going back to that open dress rehearsal, that's a chance to have a more relaxed sort of orchestra experience, and for only $5 and in the afternoon. So parking is a little easier to manage at that point. But also we have such a wide variety of music that we'll be performing this year. Take a look at our website and see what might be of interest to you. And then also we have a program at the end of the year called Music for Families, and that's a great time to bring in grandparents and kids to come hear the orchestra for a 1-hour program that's designed specifically for families.
Oh, awesome. And tell me about the kind of mix of pieces that they are picked for the season. I know there's contemporary, there's classics. Tell me about that.
Right. Maestro Rubart does a great job of selecting all different types of music that would be relatable to people in various types of situations, their families, or their culture. So again, I mentioned the bandoneon, that of an Argentinian composer and instrument is one way we can do that. But also we have the classics from Beethoven and Mozart, all the way up to, you might remember, The Sorcerer's Apprentice. We'll be playing that in our opening concert this year. So there's quite a variety of music that brings out all kinds of different emotions and thoughts and feelings.
Love that. Thank you so much for joining us today.
You're welcome. Thanks for having me.
Next up, we're discussing what you can do to keep your heart as healthy as possible. Stay tuned.
I don't remember how it started. Our back and forth, Victory. Fumble. Repeat. It always came back.
Dad! Okay, here we go, throw it! Yeah.
You probably don't remember what you told me,
That was perfect.
but I heard every word.
Nice.
Over 2 decades ago, TLC Caregivers partnered with the Council on Aging of West Florida to assist seniors with non-medical help to stay independent in their own homes. Our commitment to providing these services started in 1989 and has grown to aid people from birth through geriatrics, from a short visit of 2 hours to 24 hours a day. We're a proud sponsor of the Council on Aging of West Florida. We're TLC Caregivers.
When cancer tries to take you away from the things that matter most, Baptist Cancer Institute offers caring physicians and the most innovative treatment options. With convenient locations and a wide array of support programs and services, we're here to help you during the most difficult of times. As a member of the Mayo Clinic Care Network, we're bringing even more innovative cancer care to our community right here at home. When you need cancer care, we'll be there.
They call me Prince like I'm royalty or something. But the places I've lived ain't no palaces. So I don't need grilled salmon or a new scratching post. Just give me a cardboard box and a can of tuna and we're good. You can even change my name. I'm cool being the kitty formerly known as Prince.
Keeping your heart healthy and strong is extremely important as you age. Whether you're working to bring down cholesterol numbers or are concerned about possible symptoms of heart disease, there's plenty of things you can do to keep your heart in better health. We're talking to Katie Ulrich, a nurse case manager at Ochsner 65 Plus, to get more details. Thanks for being here today, Katie.
Thank you for having me.
First off, tell us a bit about Ochsner 65 Plus and your role there.
Okay, so we're a primary care clinic for seniors. You may have heard of Ochsner in Louisiana, the largest health system there. So we are affiliated with them. We are the first clinic outside of Louisiana and Mississippi. We are value-based care, so we focus on the patient as a whole and not just the medical side. So we understand the social determinants of health. We have a fitness center and a community room where we will hold daily events so patients can come interact with other seniors there. We have a social worker on staff as well, and a dietitian, and then eventually a pharmacist. I'm the case manager there, so I follow up with patients to make sure that they take their medications correctly. Also, like if a patient is discharged from the hospital, I will make sure that they have a smooth transition and that they see us within 48 hours of being discharged. We currently have 2 physicians, Dr. Payne and Dr. Rebecca Broschart. And then a third coming on in January, Dr. Bull. Our appointment times are 40 to 60 minutes, so we get longer times with the patient to build that relationship.
Excellent. And what are the most common heart conditions that afflict older adults?
Okay, so AFib or atrial fibrillation, which is an abnormal heart rhythm. Also coronary artery disease, we see those a lot in the elderly.
And what are some signs or symptoms of heart disease or conditions that older adults might experience and definitely need to speak to a doctor about?
So for coronary artery disease, usually chest pain, shortness of breath, also orthopnea, which is shortness of breath when lying flat. For atrial fibrillation, you might feel palpitations, also shortness of breath, and sometimes passing out.
And we often hear about cholesterol as being a big factor with heart. What is the link between heart health and cholesterol?
So usually the LDL, which is the bad cholesterol, the higher that is, the more at risk you are for coronary artery disease. So we like to keep that ideally less than 100, and in heart patients actually less than 70.
Okay. And what can older patients do to manage high cholesterol if that is something that they're dealing with?
So diet and exercise. If those don't work to bring it down, then of course visiting your physician, talking about medication. The recommendation for exercise is 150 minutes of moderate activity per week, and then 75 minutes of intense activity. Also, as far as diet goes, the Mediterranean diet is one that we recommend that focuses on whole grains, fruits, veggies, and then lean meats.
And when you say moderate or vigorous exercise, what are some examples of those that you would give to patients?
So moderate, like walking, riding a bike, even like swimming. Mm-hmm. Vigorous would be more of like heavy running, like long distance or fast-paced running.
Gotcha. What are some of the daily ways you recommend for keeping hearts healthy and strong?
Yeah, so also diet and exercise. Again, that 150 minutes of moderate and then 75 of vigorous activity.
Okay. And what else would you say about Ochsner 65 Plus and the kind of different type of care that they give to patients?
So it's more personalized care, so one-on-one with the patients. The longer appointment times help us to really understand the patient's history, what they have going on, and yeah.
And tell me more about the kind of community space, because that socialization aspect of it, that community building, is something that's so important for our older population.
Yeah, so we'll have daily activities. I think Mondays we usually do movies. We'll also have days where we play games, and then we'll also have like support groups with a social worker so patients can interact with each other.
Excellent. And is there anything else you would want to add about kind of eligibility for patients and how someone might make an appointment?
Yeah, so we currently are open. We opened last week. We're accepting new patients. We take regular Medicare currently, and then also Humana Medicare Advantage. And if they would like to make an appointment or even come by for a tour of the facility, patients can call 850-558-4665.
And where are you located?
We're on East 9 Mile, so 1095 East 9 Mile Road.
Gotcha. All right. Anything else you want to add?
I don't think so. I think that's it.
All right. Well, thank you so much for joining us today.
Thank you.
And thank you for watching. Until next time, enjoy life. You've earned it.